Hello everyone, this is Doc Willie. Today we will discuss a very important topic, thyroid cancer, specifically papillary thyroid carcinoma, and the surgery called a total thyroidectomy. Many people get scared when they hear the word cancer, but the good news is that this type of thyroid cancer is often very treatable. When a patient is diagnosed with papillary thyroid carcinoma, one of the most common treatments recommended by doctors is a total thyroidectomy. This means the entire thyroid gland, which is a small butterfly-shaped gland located at the base of your neck, is surgically removed. The primary goal of this procedure is to remove all the cancerous cells from the body to prevent them from spreading to other areas. It is a major step, but it is a crucial one towards recovery. The thyroid gland, while small, plays a very big role in our body's overall function. It produces hormones that regulate your metabolism, which is how your body uses energy. These hormones affect almost every organ in your body, controlling things like your heart rate, body temperature, and even how fast you burn calories. When cancer develops in this gland, removing it completely becomes the safest option to ensure the disease is fully addressed. This procedure is carefully planned and performed by a specialized surgeon. It is a significant decision for any patient, so it is important to have a clear understanding of why it is necessary and what to expect during the process. Facing a diagnosis of papillary thyroid carcinoma and the recommendation for a total thyroidectomy can be overwhelming for patients and their families. It is completely normal to feel a mix of emotions, including fear, anxiety, and uncertainty about the future. This is why having open and honest conversations with your medical team is so important. Ask all the questions you have, no matter how small they may seem. Understanding the procedure, the reasons behind it, and the recovery process can help empower you and reduce your anxiety. Remember, this surgery is a well-established and effective treatment, and you are not alone on this journey. Many people have gone through this and are now living healthy, full lives. The decision to proceed with a total thyroidectomy is a collaborative one between you and your doctor. They will consider many factors, including the size and location of the tumor, whether it has spread, and your overall health condition. The ultimate aim is to give you the best possible chance for a cancer-free future. While the thought of surgery can be daunting, viewing it as the first major step toward healing can change your perspective. It is the beginning of a new chapter, one that requires patience and adherence to your doctor's advice. But it is a path that leads toward wellness and getting your life back on track after a challenging diagnosis. Now let's talk about the surgery itself and something many patients are curious or nervous about: general anesthesia. For a total thyroidectomy, you will be put completely to sleep using general anesthesia. This is done to ensure that you are completely still, feel no pain, and have no memory of the operation. The anesthesiologist, a special doctor, will administer a combination of medications through an IV line in your arm. You will feel a bit drowsy at first, and then you will gently drift off to sleep within a matter of seconds. It is a very peaceful and controlled process. While you are asleep, the medical team will be monitoring your heart rate, breathing, and blood pressure very closely to keep you safe. Many patients ask why doctors often need to remove the entire thyroid gland, even if the cancer is only found in one part of it. This is a very good question. With papillary thyroid carcinoma, there is a tendency for the cancer cells to be present in multiple spots within the gland, even if they are too small to be seen on scans. These are called microscopic foci. By removing the entire gland, surgeons greatly reduce the risk of the cancer coming back in the remaining thyroid tissue. It is a proactive and preventative measure that significantly improves the long-term success rate of the treatment, making it a standard and wise approach. While you are under anesthesia, you will be completely unaware of your surroundings. The surgical team works carefully to remove the thyroid gland while taking great care to avoid damaging nearby structures, such as the parathyroid glands, which control calcium levels, and the nerves that control your voice. The procedure itself typically takes a few hours. When the surgery is over, the anesthesiologist will stop the medication, and you will slowly and gently begin to wake up in the recovery room. You might feel groggy, a bit disoriented, and have a sore throat from the breathing tube, but nurses will be right there to help you and manage any discomfort. Understanding this process can help ease any fears you might have about the surgery. The decision to remove the healthy part of the thyroid is not taken lightly. It is based on extensive medical research and clinical experience aimed at providing the most effective cure. It is a strategy of being thorough to prevent future problems. The goal is not just to remove the known cancer, but to clear the entire area of any potential cancerous seeds that might be hiding. This comprehensive approach is what makes the treatment for papillary thyroid carcinoma so successful for the vast majority of patients who undergo it. After the surgery, the next phase of treatment often begins, but not immediately. There is a specific sequence of events: surgery, a withdrawal period, and then possibly radioactive iodine therapy. After your thyroid is removed, your doctor might not start you on thyroid hormone replacement medication, like levothyroxine, right away. This is intentional. For radioactive iodine therapy to be effective, your body needs to have a high level of thyroid-stimulating hormone, or TSH. TSH is like a magnet for iodine, and a high TSH level will make any remaining thyroid cells, including any potential cancer cells, very hungry for iodine. This period without hormone pills is called the withdrawal period, and it can be challenging as you may feel very tired and sluggish. Radioactive iodine therapy is a targeted treatment used to destroy any microscopic thyroid cells that may have been left behind after surgery or that may have spread to other parts of the body. It involves swallowing a small capsule or liquid containing a special form of iodine that releases radiation. Because only thyroid cells absorb iodine, the radiation is delivered directly to the target cells, destroying them with minimal effect on the rest of your body. This therapy is usually given a few weeks after the surgery, once your TSH level is sufficiently high. It is a powerful tool to ensure that all remnants of the cancer are eliminated, further reducing the risk of recurrence. Once the radioactive iodine therapy is complete, your journey with thyroid hormone replacement begins. This is where levothyroxine comes in. Since your body no longer has a thyroid gland to produce its own thyroid hormone, you will need to take this medication every day for the rest of your life. Levothyroxine is a synthetic version of the T4 hormone that your thyroid used to make. Taking it consistently is incredibly important. It replaces the missing hormone, which allows your body's metabolism to function normally again, and it also keeps your TSH levels low. A low TSH level is crucial because it helps to suppress the growth of any remaining cancer cells, acting as a form of ongoing therapy. Finding the right dose of levothyroxine is a process that requires patience. Your doctor will start you on a certain dose and then regularly check your blood levels, particularly your TSH, to see if it needs to be adjusted. It might take a few months to find the perfect dose that makes you feel your best. This is why regular follow-ups and blood tests are a critical part of your long-term care plan. Sticking to this plan is the key to managing your health effectively after thyroid cancer, allowing you to regain your energy and live a normal, active life. Living without a thyroid gland means you need to be very consistent with your daily routine, especially with your medication. Taking your levothyroxine at the same time every day, usually in the morning on an empty stomach, is vital. You should wait at least 30 to 60 minutes before eating or drinking anything other than water. This ensures your body can absorb the medication properly. Many people ask if lack of sleep or stress can affect their recovery. While they don't directly impact your hormone levels in the same way, chronic stress and poor sleep can make you feel more tired and worsen the symptoms of hypothyroidism, so maintaining a healthy lifestyle is very important for your overall well-being. Another common question is about iodine intake. Since you no longer have a thyroid gland, your body doesn't need iodine in the same way. The radioactive iodine therapy works because the remaining cells crave it. After that, you don't need to strictly avoid or consume large amounts of iodine. A normal, balanced diet is usually sufficient. The most important factor for your health is the consistent and correct intake of your levothyroxine pill. This medication is your new thyroid, and being disciplined with it is non-negotiable for feeling good and for keeping the cancer at bay. Think of it as a simple, daily act of self-care. To help manage daily life, establishing a simple routine can be very helpful. Set a daily alarm to take your pill so you never forget. Prepare your clothes and meals the night before to reduce morning stress. Incorporate gentle exercise like walking into your day as you regain your strength. Listen to your body. On days you feel tired, allow yourself to rest. It's a marathon, not a sprint. Connecting with other thyroid cancer survivors through support groups can also be incredibly beneficial. Sharing experiences and tips with people who truly understand what you're going through can provide immense emotional support and practical advice for navigating your new normal. Ultimately, being a thyroid cancer survivor involves a lifelong partnership with your healthcare team and a commitment to your own health. Regular checkups, blood tests, and consistent medication are your tools for a long and healthy life. While the initial journey of diagnosis and treatment is difficult, life after thyroidectomy can be just as full and vibrant as it was before. By creating a stable routine, managing stress, prioritizing sleep, and staying on top of your medication, you take control of your health. You are not just a patient, you are an active participant in your own wellness journey.